Okay, we are here for part three of the JFK autopsy. If you haven't seen parts one and two, it may be worth your while to go back and do that. I am Dr. Wolfe. I'm a forensic pathologist with a lot of experience doing autopsies, especially with gunshot wounds. And I was asked to review this case, so I'm going through the autopsy report, which I obtained from archives.gov. So when we left off, we were on page three, and we were not quite finished with some of the external examination. So, situated on the anterior chest wall in the nipple line are bilateral, 2 centimeter long, recent transverse surgical incisions into the subcutaneous tissue. So, when we say nipple line, we're literally meaning sort of like top to bottom on each side in the line with the nipple, not really transversely. Although it could mean that if it was stated as such. Those are the surgical incisions that we talked about previously with regards to the subcutaneous emphysema. So that's surgical intervention there. There is no hemorrhage or ecchymosis associated with these wounds. That's important because it shows the heart was not beating. So they were attempting to relieve this subcutaneous emphysema, but there is no bleeding. So he was already dead at that point. A similar clean wound measuring 2 centimeters in length is situated on the anterolateral aspect of the left mid arm. So the antero, meaning the front of, lateral, meaning to the side of the left arm, it doesn't actually say what this was from. This was probably from some surgical intervention attempt, but we don't know why actually. Situated on the anterolateral aspect of each ankle is a recent 2 centimeter transverse incision into the subcutaneous tissue. Likewise, we are unsure why this is. And I should note that I do not have the medical records from his admission to the emergency room after he was shot. This is just the autopsy report. There is an old, well healed 8 centimeter McBurney abdominal incision. So, what does that mean? McBurney is a name, and that refers to the incision or the scar where you take the appendix out. So, he had an appendectomy at some point in the past. 8 centimeters or roughly 3 inches is pretty typical, and it's in the right lower quadrant of the abdomen. We always note past surgical intervention when we do autopsies. Over the lumbar spine in the midline is an old, well healed 15 centimeter scar. Okay, so that literally means in the lower back along the spine, there is about a 6 inch scar there. Now, this is important because he had back surgery at some point and a lot of chronic back pain, which caused him to have to wear a corset like device, a back brace corset. And if you notice the video, if you watch the Zapruder film when he's shot, he goes forward, but he can't duck down. And he can't duck down because he's actually got his torso bound. So it makes you wonder what would have happened if he didn't have that on. Could he have gotten down low enough to not get hit with the second shot? Situated on the upper anterolateral aspect of the right thigh is an old, well healed 8 centimeter scar. So, again, about a 3 inch scar on the front side of the thigh. It's probably just an old injury. All right, so now we're really getting into some forensic stuff. This section here is entitled Missile Wounds or Missile Wounds, which is the way that we used to call gunshot wounds, and some people probably still refer to these as missile wounds. I personally do these as gunshot wounds now, but technically speaking, missile is fine. So, number one, there is a large irregular defect of the scalp and skull on the right, involving chiefly the parietal bone, but extending somewhat into the temporal and occipital regions. In this region, there is an actual absence of scalp and bone, producing a defect which measures approximately 13 centimeters in greatest diameter. So, I'm going to post some drawings that I did, kind of a recreation of their description in just a moment, but I'm going to go through the next points which describe the gunshot wounds. From the irregular margins of the above scalp defect, tears extend into stellate fashion into the more or less intact scalp as follows. So, in other words, there's a large hole, and stellate means that actually translates as star like. So, there are little points coming off the edge of the wound. And this is the distribution of those injuries. A, from the right inferior temporal parietal region anterior to the right ear to a point slightly above the tragus. And so the tragus is going to be here. I'll post a drawing on that. B, from the anterior postparietal margin anteriorly on the forehead to approximately 4 centimeters above the right orbital ridge. So it's going to be over here, or actually, this is my right side. It's going to be here. C, from the left margin of the main defect across the midline anterolaterally for a distance of approximately 8 centimeters. And then D, from the same starting point as in C, but 10 centimeters posterolaterally. So let me show you what that looks like. All right, so I made a little drawing just for anatomically, for those who don't have medical background, what these regions mean. So when you hear parietal, occipital, frontal, and temporal, this is what we are talking about. So kind of burn that into your brain or screenshot it or scroll back and watch this so that you can know what that means with respect to what the autopsy report said. All right, so this is the drawing I did. The red represents the area of injury and its distribution. Okay, we're looking at the right side of the head here. So you can see at the very top there where it says 13 centimeters, what the pathologist is describing is the maximum dimension of that wound is going to be 13 centimeters, which is about 5 inches. And then coming off that are those stellate tears, which is very typical of a very severe gunshot wound of the head. And those tears are going, as you can see, to the frontal, to the temporal in front of the tragus, to the back of the head or the occipital, and then, of course, to the parietal region. So as you can see, this is a very large and severe head wound and is not survivable under any circumstance. We will continue the description of this wound in part 4, which gives a little more detail as to what the actual gunshot injuries, once they went inside the head, that looked like.